You are listening to Medica Talks, which brings to you all the exclusive healthcare industry news, views, and opinions from across the world.
Hello listeners, I'm Urvashi. Today we will discuss about wound management. Hello doctor, welcome to our podcast for patients, caregivers and healthcare professionals at Medica Talks. Doctor, can you tell us what wound management is?
A wound is defined as a discontinuity of the epithelial lining of the skin or mucosa due to physical or thermal damage, and they can be present over different anatomical parts of the body. However, the basic principles of choosing a wound dressing remains the same. In the United States, chronic wounds affect more than 6 million people, and this will grow in numbers due to our elderly and diabetic populations. Choosing the correct dressing will lessen the time of healing, provide cost effective care, and improve the patient's quality of life. The goal is to help the wound heal as soon as possible by using an appropriate dressing material to maintain the right amount of moisture. When the wound bed is dry, use dressing to increase moisture, and if too wet and the surrounding skin is marrated, use materials that will absorb excess fluid and protect the surrounding healthy skin. Important criteria to consider before choosing a specific wound dressing and cleaning is absorbing, regulating, and the need to add medication. It is important to choose a dressing guided by the cost, ease of application, and clinical preference.
How is wound management done?
The wound should profusely irrigated with a neutral solution like normal saline to wash off any debris. The use of toxic or irritating solutions like hydrogen peroxide must be avoided as they are detrimental to wounding healing. The next step is to choose a dressing material that is easy to replace, stays in place with appropriate anchoring, and does not cause harm to the wound bed or normal surrounding skin by shearing force or sticking to the skin. Patients can develop complications like contact allergic reactions. The ideal dressing should keep the wound moist but not Meriated, limit bacterial overgrowth, keep odor to a minimum, and be comfortable to wear. Frequent inspection of the wound is necessary to optimize wound dressing selection. Today, there are many types of dressing and even techniques to manage wounds. For the most part, the majority of wounds that require special dressing are chronic wounds or surgical wounds. The overall objective of a wound dressing should decrease the pain, apply compression for hemostasis, protect the wound from the environment, protect the wound from soiling with the body fluids or waste, immobilize the injured body part, promote wound healing also before applying any type of wound dressing. It is important to assess the following mechanism: the mechanism of injury, risk of contamination, injury to deeper structures, underlying nerve or tissue damage, any perfusion deficits, tetanus status, disability, amount of tissue loss, whether there is a non healing or chronic wound or a wound caused by trauma. It is important to get an x ray to ensure that there is no fracture or a foreign body left in the tissue. If the x rays do not reveal a foreign body, then ultrasound is a useful technique to identify radiolent foreign bodies like splinters or thorns.
What are currently available dressings?
The semi permeable dressing allows for moisture to evaporate and also reduce pain. This dressing also acts as a barrier to prevent environmental contamination. The semi permeable dressing does not absorb moisture and requires regular inspection. It also requires a secondary dressing to hold the semi permeable dressing in place. Stule is a non adherent dressing impregnated with paraffin. It aids healing but does not absorb exacerbate. It also requires a secondary dressing to hold in this place. It is ideal for burns as one can add topical antibiotics to this dressing. It is known to cause allergies and this limits its wider use. Plastic film dressings are known to absorb exudate and can be used for wounds with a moderate amount of exudate. They should not be used on dry wounds. They often require a secondary dressing to hold the plastic in place. Hydrogels are insoluble and hydrophilic materials that are made from synthetic polymers which have a high water retention, that is 70% to 90%, that helps granulation tissues and epithelium in a moist environment. It also decreases the temperature of cutaneous wounds, resulting in a soothing and cooling effect. These may be used for dry, chronic wounds, pressure ulcers, neurotic wounds, and burn wounds. Setbacks involving these dressings are that exudates accumulates and leads to medication and bacterial proliferation, which then produces a foul smell in the wounds. Fixation sheets can conform to body contour and provide pain relief and also allow exudate to escape. These sheet dressings do need oil application before removal and can be used to manage low intensity wounds that do not require medical checkups. They should not be applied to infected wounds. Calcium alginate dressings keep the wound moist, reduce pain, and can be used to pack cavities. They also provide homeostasis and absorb excess exudate. It has been reported that allignates accelerate the healing process by activating macrophages, which in turn produce TNF alpha, which initiates inflammatory signals. They should not be used in the presence of an infection or on dry wounds. Often, another dressing is required to hold the alginate in place. Foam dressings keep the wound moist, can absorb fluid, and can also protect the wound. They can be used on wounds with a moderate amount of exudate and should be avoided on dry wounds. They can be painful to remove if they dry out. Hydrocolloid dressings are made up of a combination of gel forming materials, that is, carboxymethylcellulose, gelatin, and pectin, with other agents such as elastomers and adhesives. These treated dressings retain moisture and are painless to remove. Thus, their indication in the pediatric age group. They are ideal for small abrasions and not to be used on dry or infected wounds. Paper adhesive tapes is used for just approximating wound edges and ideal for small wounds. The tape is not useful on wounds with large exudates. Medicated dressing, including antimicrobials, are being explored as a new entity.